Hip pain can interrupt your daily life. The hips are absolutely essential because we're standing, we're walking, we're sitting. And if you cut me in half, you're gonna cut me right through my hips, not my abdomen. Our abs are important, but probably 80-20 rule. 80% is the hips, 20% the abdomen. If we're fixing low back pain, we need to fix your hips. So attacking the hips and getting the right intervention for long-term improvement is gonna be great for your overall health. But in this video, we're gonna dig down and do specific exercises to fix your hip pain. It'll be less than 10 minutes, but we wanna do it twice a day. So let's get right into the exercises. And if you stick around, then we'll explain the why you're dealing with hip pain, and most people deal with hip pain. So let's get right into those exercises. The first thing we need to do is loosen up the muscles around the hip. So right here in my glute. So if you look at me from the side, it's gonna be in between the hip bone and the pelvis. We're gonna cut it in half right here where a guy has a belt loop. And then I'm gonna move back about an inch. So right here on the side. So when I do it, I'm gonna start doing it up against a wall. So we're gonna use this wall so that you can see better. So right here, you can see hip bone, pelvis, cut it in half, and then come back about an inch. So I'm gonna start sideways on the wall, and then I'm gonna rotate my body about 30 degrees right here, and then I'm gonna drop it down a little bit so I can sit down into it. So I wanna loosen up this muscle tissue. We're always gonna do 3 things with our exercise program. We've gotta loosen up muscle tissue, we gotta fire up the correct muscles and get motor recruitment, and then we need to work on our movement patterns so that we're using the hips with all of our exercise. We're not overloading the knee, overloading the back, or causing any hip dysfunction. So I'm gonna do 1 minute. So I'm right here on the glute, off to the side. I don't wanna be back here. And you can be off to the side a little bit more, but this is where muscles overlap and they get stuck together. So I'm gonna be about a 30-degree turn, drop the ball down a little bit. And so I'm gonna put it over my shirt so you can see it really good. And I'm spending about a minute right here, just digging into that muscle tissue. And so 1 minute on each side. We never wanna just leave, you may have hip pain just on one side, but we wanna use both sides, making sure that we're getting the muscles to loosen up and make sure they're gliding across each other. So 1 minute, you can wiggle around a little bit. We can wiggle like this, just little small motion. What I don't wanna do is be wiggling through my back or twisting up on my knee. You can also just kind of sit into it. So sit into it and let those muscles relax. All my weight is on my right leg right now, and I have my left leg touching the ground, my foot touching the ground, but there's no weight through it. So now I'm gonna switch, you can see it from the back. So I'm right here, off to the side, and then I'm gonna rotate about 30 degrees. And so you can see that I'm digging in that muscle, and when I move, I just move just a little bit. That little wiggle is like somebody kneading their thumb into that muscle tissue. So that's the first thing we do. So that's 2 minutes. So 1 minute on each side. And let's go to number 2. Number 2, we call it the samurai suicide. It's a seppuku. So we're digging right here inside the pelvis, digging into this muscle right here. So I'm gonna do the same thing for a minute. I'm gonna dig into that muscle, and I don't wanna put weight through that leg. I want that muscle to relax. So we call it samurai suicide. We're digging into that muscle. We go down and out for 1 minute. And what you can do is get up against the wall right here, and I unweight this leg, and I'm digging into that muscle, and we can knead right here, just gliding any type of tool. You can use a rolling pin at home. I'm doing 1 minute on each side. You can also do it laying on the ground with the knees bent. We lay down like this, and then I'm digging down and out into that muscle, loosening up. So now I've loosened up the glute and I've loosened up the hip flexor. So now all those muscles are able to glide across each other. So let's get right into firing up those muscles. Our first activation exercise is getting into a hip hinge and firing up our adductors right here. It's like the rotator cuff of the hip. It pulls the joint, the ball into the socket. So I'm gonna measure my foot away from the wall, and then I'm gonna put this between my knees, bring my feet together, so they'll be about 6 inches apart, and I'm gonna squeeze my knees together. I'm pushing my butt back against the wall, my toes, everything stays down, and I'm squeezing while I push my butt back into the wall. So I'm pushing back at the same time as squeezing my knees, and I'm gonna hold this for 30 seconds. You should not feel any pain in your back, any pain in your hip. We shouldn't be feeling any pain anywhere when we're doing these exercises. So you can see that my head is in neutral with my spine, and I'm pushing my butt back. So when my weight's mostly on my heels, but my toe is staying down, I'm activating these muscles on the back side of my leg at the same time as activating the muscles on the inside of my thigh right here. So I'm doing 30 seconds and then I relax. I'm gonna keep that ball squeezed for about 10 seconds while I relax. And then I get into that hinge position again, squeezing the ball, holding it for 30 seconds. And so we're just priming those muscles and waking them up right now. I'm holding that for 30 seconds. So I got 2 sets of 30 seconds with our adduction squeeze. Let's get into number 4. Number 4 is our second exercise. So we're activating muscles right here. So what I need is a pillow. And I'm gonna go up against the wall and I'm gonna put my hip, I want the pillow on my hip right here. So I'm gonna hinge back, allow my chest to come down. This is a good athletic position. It's something that we want to remember. If somebody shoves me and I'm upright, it's easy for me to fall backward. If somebody's shoving me and I'm in this position, I'm activating my glutes and I'm able to stop them. I have much more power because I'm using my glutes in this position. So I'm gonna get back into my hinge and I'm gonna put this pillow against the wall. And then now I'm driving, we're doing 30 seconds right here. I'm driving the ball of my foot, my heel, my entire foot is driving into the ground and coming up through my hip. I don't want my knee twisting up at all. And I'm pushing, I'm about 50% pressure in the first 10 seconds. And then I move up to 75% pressure. And then in the last 10 seconds of my 30-second slot, I'm getting 100% pressure, really driving into the wall using these glute muscles. And then I'm gonna rest and I'm gonna go back into it. So we're doing 2 sets, setting up right here. I'll show you on the other side. So I get this, I hinge back, I get the pillow on my hip. And so this shouldn't be painful either. If you're having pain on the outside of your hip, then I want you to make sure that the pillow has enough cushion that it's not aggravating it. We don't want to cause more inflammation while we're trying to fix something. So I'm gonna go right here. If you are having pain, leave us a comment, let us know, and we can give you an alternative. One thing that you can do is get into that hinge and drive my knee, my leg out to the side right here. If you are having pain with the hip, that's an alternative. But right now, it shouldn't be painful. When we go right here, I go into my hinge position, I drive over to the side, and I'm driving into the wall. The foot is engaged with the ground. I'm resting my right leg down, and I'm driving using all this hip, driving into the wall. So 50% for 10 seconds. Now I'm driving 75% for 10 seconds. And then 100% for 10 seconds, lighting up. You should feel this all through the leg and all through the glute, firing up those muscles. So let's get into number 5. Number 5, this is our movement pattern. So we're doing a hip hinge squat. We've been talking about it a lot. It really takes repetition to get it down, but it is the absolute most important thing for utilizing our hips throughout the day. I'll go into more detail later, but it is really, really important. So I wanna make sure that you get this and that you can keep this up because that's what's gonna keep your hip healthy long-term. What I'm gonna do is measure my foot away from the wall, and then my lower leg stays vertical. Like I went camping, it's a stake driven into the ground. I'm gonna keep my face in line with my chest. So if I have eyes here and eyes here, they're gonna stay with each other. And I'm pushing my butt back, touching the wall right here, and then pushing forward with my hips. So hips back, touch, hips forward, touch. Well, no touch. Hips forward, relax. I don't need to squeeze at the top. I really don't want to squeeze at the top because what ends up happening is we squeeze at the top, but we do back extension instead of doing hip extension. So I'm getting the most activation when I get right here. My glutes are really lit up right here. We don't need to focus on anything with our feet besides keeping our lower leg vertical, and most of my weight is through my heels. So I'm driving back and I'm just doing 10 reps of this, really focusing on having really good form, not back extending and not swaying with my knees forward or my knees back. So that lower leg stays vertical, tap, forward and backward motion. And you can use this if you're trying to pick something up from the ground. I'm driving back, you can get down to the ground. So this is a movement pattern that we want to get really good at that we're using throughout the day. So I'm doing 2 sets of 10 right there. In number 6, we're going to do something called a Cossack squat, but we're going to do it against the wall. So we're going to separate our legs apart, And so now I want to make sure that my butt bones both touch the wall. So I'm driving out to the side and touching the wall. So I'm gonna step forward just a little bit. Same measurement that I stay about my foot length. So for you, your foot may be longer or shorter depending on what size you are. So we always wanna measure with our own foot. So I'm coming right here and I'm separating my feet just a little bit more. I want my knee to track with my second and third toe, in between the second and third toe. So I'm driving out to the side, trying to keep this, my longer leg. I want to keep it relatively straight, but it doesn't have to stay totally straight. So I'm driving over to the side and I'm gonna do 10 repetitions. I want my butt bones to both touch the wall. So, and I wanna make sure that I keep weight through my big toe on the side that I'm moving to, weight through the big toe, that my butt bones are even when they touch the wall. And I'll show you what I mean. A lot of times when people do this, they'll rotate like that. So when they rotate, they're twisting up on the knee and we're not activating the muscles that we're looking for. So this is why I like doing it against the walls, because you can feel both butt bones are touching the wall and we're staying even. And this is a functional exercise that's working our adductors and getting that ball and socket to stay together. So I'm doing 10 repetitions, driving back, keeping that leg relatively straight. So now I'll show you from the front. So I'm separating out, my feet are pointed slightly out, and then now I'm gonna go to the left. Now I'm driving over to the left side, tracking that knee with the second and third toe, and I'm driving back, touching with both butt bones each time. And then I'm putting pressure through my big toe on this side. I don't wanna be tilted all the way out to the side. I'm gonna lose a lot of the activation that I'm looking for. Now, a question that we get a lot of times is, are you pushing with this leg or are you pulling with the other leg? I wanna focus on my push and getting length right now. This is our first video of a 3-part series because we need to make progressions. And so we're gonna make some little adjustments, but you wanna get a long-term resolution, we've gotta make progressions, we gotta be consistent with this. So I'm driving over to the side, ball of the foot on each side is staying down, butt bones are touching the wall, and I'm just doing one set of 10 repetitions one way, one set of 10 repetitions the other way. Make sure you follow us and hit the bell icon. So when we post new videos, you don't want to miss the progressions to this. If you're looking for long-term improvement with your hip, make sure that you get to level 2 and level 3. In progressions, if you are consistent with twice a day, we can make a progression at 2 weeks. If you're doing once a day or you're not as consistent, let's make our progression at 4 weeks. That's a good rule of thumb. We make our progressions, the exercises stay the same difficulty level, but they're more challenging. So we're challenging the muscles, we're getting better, but it's the same difficulty level for you because these things are gonna start to get easy when you're consistent. Now for the fun stuff. Anatomy and why is your hip bothering you in the first place? And this is what I love talking about because I want you to understand what you're doing to fix it and why this is helpful. We have a 94% success rate. Almost everybody that comes in gets better. That 6% drives me insane. So what we have with the hip is called AGMR, and that's when it gets nerdy. So it's a forward pull. So it's the ball is being pulled forward and it's going inward because of a muscle imbalance. So let me grab one of my models. Okay, now I got my models. Get your hand off me. Okay, so now we need muscles because the muscles move bones or the bones move muscles. You're right, the muscles move the bones. So we've got to address the muscle. That's why we did our psoas. We loosened up that muscle. This is the psoas right here. So the front of the pelvis, the guts are cut away. You can see the spine, you can see the pelvis, and you can see the hip. This is called the lumbopelvic girdle. When we sit for long periods of time, our hip flexors get tight, and what happens is we get something called reciprocal inhibition. So reciprocal inhibition is that when I flex my bicep as hard as I can, my tricep has to be loose. When my hip flexors are really tight on the front side of my body, it doesn't allow me to fire up my glutes very well. And so that is something that's compounding. We all know about compounding interest. We hear it all the time. So with investments, we have compounding. Well, with our body, we have compounding as well. we're having a problem that's compounding, and we're getting less and less balance in that joint. What we're doing right now with this video and these exercises is we're restoring the balance in that joint so we stop grinding. So something that you can see with this model is that when these muscles on the front side of the hip right here, they're attached to that inside, it's attached right here. When that's really tight, it's pulling the ball into the socket and it's grinding on the front side right there. So you'll have a lot of pain in that groin area right here. Sometimes you have sciatica on the backside. That's a total imbalance in those muscles, and we've got to restore that. So first thing we do is loosen up that muscle tissue. So we loosen up the backside off to the side of the glute. We loosen up the front side so those hip flexors are gliding properly. And then we fire up the glutes and we fire up those muscles on the inside of the thigh. And then we build up a program so that when you're restoring balance, that we're challenging those muscles through more and more ranges of motion that you're gaining, because you're earning the range of motion that you're getting. So that AGMR is that forward glide and inside rotation, and so we're grinding on the front side. So we loosen up the muscles on the front, loosen up the muscles on the back, fire up the muscles on both sides. When we do that consistently, we restore the balance. So now that ball is a centrated joint. It's gliding in the capsule. So loosening up the muscles by itself, not enough. Stretching by itself is not enough. And then exercise by itself is not enough. We got to do all three. So follow us for videos on exactly how we fix these problems for our clients here in the clinic. This is exactly what we do for them here at the clinic, but you can do it from your own home anywhere in the world. So leave us questions. If you have any problems, if something doesn't really make sense, leave us a question, because that gives us ideas on what we're posting, because this channel's for you. We want to make sure that you get long-term resolutions to your pain. We'll see you in the next video.